Healthcare Theory Applied to Practice, our research study. The article we chose for our presentation is one that was suggested when researching articles using Pender's health promotion model, Group Exercise Mode and Health-Related Quality of Life Among Healthy Adults by Jennifer McGrath, Maureen O'Malley, and Thomas Hendricks. According to McGrath, O'Malley, and Hendricks, physical inactivity is detrimental to health and well-being and contributes to the development of many illnesses. Physical inactivity not only contributes to certain illnesses such as diabetes, hypertension, and heart disease, it also contributes to increased healthcare costs. Pender's conceptual model for preventative health behavior was the framework that was used. According to Pender, the nurse identifies personal, interpersonal, and situational factors that motivate or inhibit preventative health actions. Personal factors include the individual's perception of the importance of health and perceived efficacy of action. Interpersonal factors include the concerns of others, historical family patterns of utilization of specific health behavior, expectations from friends, and informational input from health professionals. Situational determinants include cultural acceptance, societal group norms/pressures, and information from non-personal sources. So pretty much all these factors were explained by Rachel in the previous slides. The aims of this particular study were to identify the differences between mode of group exercise and health-related quality of life, to determine the associations between mode of group exercise chosen by participants and their demographic characteristics, and to identify themes from narrative comments from each group exercise modality. All participants met the following inclusion criteria. The first one is attended one of 3 group fitness classes: Pilates, strength training, or step aerobics. Number 2, they were all aged 18 years or older. And number 3, they all needed to be able to read and write English. The findings concluded that among adults, modes of exercise exert varying influence on health-related quality of life domains. Therefore, healthcare providers should understand the impact of the most common modes of group exercise. This would allow them to educate their clients better to achieve a more favorable quality of life and to motivate those who are inactive to exercise. Healthcare providers should encourage adults to increase their intensity of exercise to benefit from higher levels of health-related quality of life. And finally, nurses need to develop effective strategies to help adults improve their motivation and achieve better overall outcomes, such as providing education on the emotional, physical, and social benefits of group exercises. In this particular study, however, Pender's preventative health behavior model was applicable in explaining and predicting preventative health behaviors in adults participating in one of 3 of the group exercise modes I explained, which was Pilates, step aerobics, and strength training in the domains of health-related quality of life. Joyce will now explain, while using Pullett and Beck's box 6.2, guidelines for critiquing theoretical and conceptual frameworks to evaluate the use of Pender's theory in this quantitative research study.